Hello and welcome. Today, we're diving into a condition that affects the mouth and can sometimes be a bit of a puzzle, oral lichen planus. We'll explore what it is, why it happens, how it's diagnosed, and what can be done to manage it. So, let's get started on understanding this chronic inflammatory condition. The exact cause of oral lichen planus remains somewhat of a mystery. It's believed to be an autoimmune disorder, meaning the body's immune system mistakenly attacks the cells in the oral mucosa. Several factors can trigger or exacerbate this immune response. These include genetic predisposition, certain medications like NSAIDs, beta blockers, and some anti-malarial drugs, as well as infections, particularly hepatitis C, stress, anxiety, and local trauma might also play a role in triggering or worsening symptoms. Now, let's talk about what's actually happening at a cellular level. In oral lichen planus, immune cells, primarily T lymphocytes, infiltrate the epithelium, which is the lining of the mouth. These immune cells then target and destroy the basal keratinocytes, which are the cells responsible for forming new skin cells. This process leads to inflammation and characteristic changes in the oral mucosa, such as the formation of white, lacy patterns or erosions and ulcers. Oral lichen planus is a relatively common condition, affecting approximately 0.5 to 2% of the general population. It's more prevalent in adults, typically between the ages of 30 and 60, and it's also more frequently seen in women than in men. While it can occur in people of all ethnicities, some studies suggest variations in prevalence across different populations. The signs and symptoms of oral lichen planus can vary widely from person to person. Some individuals may experience no symptoms at all, while others suffer from significant discomfort. The most common presentation is the appearance of white, lacy patches called Wickham's stria, usually found on the inside of the cheeks. These patches are often painless. However, other forms of oral lichen planus can cause redness, swelling, open sores or ulcers, and a burning sensation. These erosive forms can make eating, drinking, and even speaking painful. In some cases, the gums, tongue, and lips may also be affected. Diagnosing oral lichen planus typically involves a thorough clinical examination of the oral cavity by a dentist or oral surgeon. The characteristic appearance of Wickham's stria is often suggestive of the condition. However, to confirm the diagnosis and rule out other possibilities, a biopsy is usually performed. During a biopsy, a small tissue sample is taken from the affected area and examined under a microscope. This microscopic examination can reveal the characteristic inflammatory cell infiltrate and damage to the basal keratinocytes, confirming the diagnosis of oral lichen planus. Oral lichen planus is often classified based on its clinical appearance. The reticular form, characterized by Wickham's stria, is usually asymptomatic. The erosive form presents with painful ulcers and redness. There's also a papular form, consisting of small, raised bumps, and a plaque-like form which appears as thickened, white patches. Atrophic lichen planus causes thinning and redness of the oral mucosa. The erosive and atrophic types are more likely to cause significant discomfort and require treatment. Unfortunately, there's no cure for oral lichen planus, but the goal of treatment is to manage symptoms, reduce inflammation, and promote healing. Treatment options vary depending on the severity of the condition. For mild cases, topical corticosteroids, such as mouthwashes or ointments, are often prescribed to reduce inflammation. More severe cases may require systemic corticosteroids, taken orally or injected. Calcineurin inhibitors, like tacrolimus, are another option, especially for erosive forms. In addition to medication, good oral hygiene is crucial. Avoid irritating foods like spicy or acidic items, and see your dentist regularly for checkups and cleanings. Stress management techniques can also be helpful, as stress can exacerbate symptoms. While oral lichen planus can't be completely prevented, there are things you can do to minimize your risk and manage symptoms. Maintaining excellent oral hygiene is key. This includes brushing your teeth twice a day, flossing daily, and using a soft, bristled toothbrush. Avoiding known triggers, such as certain medications or irritating foods, is also important. If you suspect a medication is contributing to your symptoms, talk to your doctor. Regular dental check-ups allow your dentist to monitor your condition and detect any changes early on. Finally, managing stress through relaxation techniques, exercise, or counseling can help reduce flare-ups. Oral lichen planus is a chronic condition, meaning it can persist for months or even years. However, it is not life-threatening. Many people experience periods of remission where symptoms improve or disappear altogether, followed by flare-ups. The prognosis is generally good with proper management, but it's important to note that some studies suggest a slightly increased risk of oral cancer in individuals with oral lichen planus, particularly the erosive form. Therefore, regular monitoring and follow-up with your dentist or oral surgeon are essential. Recent research is focused on identifying the specific immune mechanisms involved in oral lichen planus and developing more targeted therapies with fewer side effects. Researchers are also investigating potential biomarkers that could help predict disease progression and response to treatment. Additionally, studies are exploring the role of genetics and environmental factors in the development of oral lichen planus.